In this video, we are going to discuss important aspects of case study, case report, and also we'll talk about the case series. To start with, when we talk about the case study or case report, this usually describes the details of a single case that is presented with unexpected, striking manifestations or phenomena or clinical picture that has not been reported before. And so, for examples, we can talk about adverse reaction of a certain drug, that uh, an adverse reaction that has not been reported before and rarely reported, and this could be an important element or important aspect to discuss in a case report or in a case study. Unexpected therapeutic outcome, that you use a certain drug and then the outcome is unexpected or unique, and you cannot find it reported in previous literature, for example. And then also uh, subject for the case report could be teratogenic effect of a baby due to medication that has been used by the mother during embryogenesis, during pregnancy. For example, the use of steroids during pregnancy can result in cleft lip or cleft palate, for example. And unexpected event in the course of treatment on observing a certain patient that had received a specific medication for treatment of any of disease, whether communicable or non-communicable, and then the unexpected outcome has happened. New findings of pathogenesis of a disease of a certain adverse reaction or rare manifestations of a disease that you come upon in clinical practice to certain clinical symptoms and signs that are unique or rare for that disease, as it has common features and common clinical presentation. Also, a positional quantitative variation in the anatomical structure, for example, in any of the organs, you find that there are anatomical abnormal anatomical positions, for example, or anatomical structure that uh, has been there is variation in its that is anatomical structure. In addition, the researcher is expected to describe the details of the phenomena. You have to give full details. For example, if you are talking about a clinical case, you have to give all the whole story. You talk about the presentation, the symptoms, the signs, the investigations, whatever you come upon for that case, and then you have to propose at least rational explanation for the phenomena. You have to have some sort of logical reasoning for what has happened, and maybe that you can formulate a hypothesis to explain the phenomena. However, hypotheses cannot be tested in case study, but we need other design to test. Often in case study, you can answer is what is happening and what's happening and what happened, but we cannot answer why and how. That questions cannot be answered in case study. In medicine, case report or case studies usually include symptoms, signs, diagnosis, investigation, treatment, and follow-up, and therapeutic outcome, for example. And some case reports may include literature review. Maybe there are uh, similar cases reported before, so or published in peer-reviewed journals, so that you can go for the previous literature and include it in your case report. Lastly, the evidence generated by case report is always questionable and needs to be carefully scrutinized in evidence-based medicine and in clinical practice and in medical practice in general, not get evidence out of a case report that the evidence is weak to be included. Publishing case reports, many international journals will publish case reports, but they restrict the number or the percentage that appear in the print run, because this may have an adverse effect on the impact factor of the journal. So they make some sort of limitation for the number of case report to be published annually. So such restrictions may be an obstacle for the investigator to publish a case report. However, there are a few of the journals that are devoted to publishing case reports alone, where they are all open access. And the first of these to start publishing in year 2001 is Grand Rounds, and this is available in the website address that is shown here. Now we talk about case series, which is a group or series of cases, case reports involving patients who were given similar treatment, for example. And reports of case series usually they have detailed information and background information about different individual cases, that what has happened for those. And these include background characteristics, for example, age, gender, occupation, residence, and other socioeconomic background characteristics. Information about the diagnosis, the treatment, the response to treatment, and follow-up of the treatment and therapeutic outcome if ever that case received any sort of treatment. The distribution of cases may be an important factors that regard the time of and place and persons. These parameters may give clue to the diagnosis or to the disease, and might produce initial suspicion regarding the potential causes, what are the underlying causes based on the distribution of the cases, whether by time or place or by person, and might lead to more detailed descriptive studies from which hypotheses may be generated and tested by, for example, cross-sectional descriptive studies or other types of studies. A famous example of case series was the observation of HIV/AIDS as reported by the CDC in the period October 1980, May 1981. 5 young men, all active homosexuals, were treated for biopsy confirmed Pneumocystis carinii pneumonia at 3 different hospitals in Los Angeles, California. And that was the start of the story of the HIV/AIDS, which proved later on after years. The advantage of case series is that they are useful explaining unusual or rare or unique presentation of a group of cases, whether the symptoms or the signs or whatever it is. The series of cases may be study subjects for further research on etiological association, progress, intervention, therapeutic outcome, and prognosis. And also, the generated data can be used to formulate hypotheses that can be tested by other study designs. This is the advantage of case series, is that the duration of the study is short and may be inadequate to present the whole picture. Maybe the information is inadequate to explain for us the whole picture of the whole clinical picture. For example, as the period is short, maybe the symptoms which we reported are inadequate to explain the whole symptoms. The series of cases may not be representative for all cases. For example, other cases may have different clinical manifestations or different clinical picture, but we only report a series of cases. So this may be a disadvantage for the case series. Selection bias. Investigators select the cases to be included, and usually there is no case control for comparison, which is another disadvantage which for the case series. Thank you very much.